today and just kind of give you an update. I know that we've had some things. Why is that not working? Trying to get this to work here. Let's see. That's not working either. Bear with me, guys. I apologize. So what we're looking at today is kind of an update where we are. I know that you saw, maybe that'll help out a little bit. You saw what happened today. The county issued a declaration of emergency this morning, and talking about pretty much the same thing that we've been talking about all week, and what we've been going through when it comes to what's going on in our city, what's going on in the county as well. Let's see, this is not helping me out here. Oh, I can move that. There we go. Now we're working. Sorry, hey guys. So here we go. All right, helps out. So state of emergency, pretty much the same thing. I ask for your patience when it comes to that. I know that some of you have called in about going to the grocery store, going to the pharmacy, and it not being completely seniors at that time, and then also some of the establishments that we issued in order to close, still working on getting closed. So we're working through that. We're working through and sending our codes department and our police department out to make sure that we're providing the best service that we can. Just wanted to, there's been a lot of questions. We issued the closure of bars and half capacity of restaurants. I know what that does. Believe me, there is no decision that I've made this week that has been an easy one. I know that we have impacted lives beyond just today and tomorrow, but for possibly weeks on end, and that's something that I don't take lightly at all. So I do want to say this to start out, that I'm deeply empathizing with all of you, and what I have committed to do is we are committing $10,000 on top of the already $20,000 that the West Tennessee Healthcare Foundation has to help with those people who are losing jobs right now that possibly can get displaced. And so that $10,000 I'm issuing also as a challenge to you all in Jackson. That is a matching $10,000. So every dollar that is donated from 4 o'clock today to on for till $10,000, I will match with $1. So that the goal is to get an additional $20,000 into that account, and so that's the goal. So we want to make sure that we're providing those resources, and we're working on providing ways for those of you who have been displaced, who've lost your jobs, to get to that application process, and we can streamline that for you as well. There's been a lot of questions about gyms, about hair salons, nail salons, grocery stores, and so I just want to go through that and talk about that. Those are venues that are open to the public, so they still have to follow within the guidelines of 50% capacity or 100 people, whichever one is the lowest. And we're going to be watching that. There is no specific order for hair salons or nail salons to close down right now. I do urge you, I'm trying to provide guidance to you and asking you, please be cautious when you are making your appointment to get your hair done. I strongly recommend not to do that right now, not to get your nails done, not to get your hair cut. I know that it impacts businesses, it impacts people, but we are at the point of trying to make sure that we're flattening the curve. We have a healthcare system that can provide the services and the needs when it comes up. We did see that the numbers are increasing exponentially. Good question where to donate. You can go to WTHfoundation.org, or you can send it to 94 Directors Row, I believe is what it is, but WTHfoundation.org is a website to go to give to that fund. When are we going to have free drive-through testing? Yeah, those are, so cases in, so the first two, really questions I see are cases in Jackson and drive-through testing. Folks, I wish I had much better news and could tell you that we have as many test kits that we need. The reality is that we don't. We don't have that many test kits. That's why you see right now that we are only testing if you following all the criteria of high risk or and have symptoms. And so there is a shortage. We have reached out to our legislators. We have reached out to our congressmen to help us get testing in West Tennessee. Understandably, I think the rationale is that the tests go where the cases are right now, and so those tests are following. We do not have any confirmed cases in Madison County as of today. We still have several tests, 10 I believe, that are out. Every test that has come back so far has been negative, and but that doesn't mean that there has been no one infected by COVID-19. It may be someone that falls under 65, or someone that doesn't have all the symptoms, or someone that is not high risk, and so they're not being tested. And so we're trying to practice caution, social distancing, to make sure that this doesn't spread. I've heard people say, well, it's just a bad cold, it's just kind of like the flu. True for most people, but for those 20% of people, it's far worse. And so we're making sure that we're trying to take precautions now so that our healthcare system can handle whatever the numbers are that come in that need to be seen, and we don't face a situation like other countries have where our healthcare system can't handle the capacity and collapses. That's when it becomes catastrophic. And we're trying to prevent something from catastrophic from happening. And so that's what we're trying to do right now. But we're trying to get confirmed cases. So it would be, Wall Street Journal just put an article out about drive-through testing, how it has failed in so many areas because the test kits are not available. Now, I am not a healthcare professional, and so I do know that it's what you send it off with. So the test tube and the solution that the swab has to be in has to be a certain chemical, and so they have to send it off that way. And so that's what we're lacking right now. Schools, it's a great question. Schools are right now, March 31st over there. I'm sure that, obviously with everything else that we're doing, there's nothing that is set in stone. Everything is fluid and changes minute to minute, hour to hour, and day to day. And so the week before March 31st, or the week of March 31st, there could be an announcement to extend closure of schools. I wish I had the ability to say, this is the day schools are going to start, this is the day everything's going to go back to being normal, but we don't have that information yet. And I don't know that we will know that it's going back to normal until it's already been back to normal. And so these are precautions that we're taking. Someone asked about Madison County Hospital capacity. I think as of right now that we have capacity. We have beds of 250, I believe, that are not filled right now. That's including the North Hospital. There's also several rural hospitals that are closed that could possibly be opened up, but that would take a lot of manpower and a lot of money to get that back up. Oh, we're coming in kind of quick now. Hold on, I'm trying to get to the numbers. Okay, hold on. So grocery stores like Conger, what are they doing sanitizer-wise and limiting customer size to prevent the possible spread? Have you touched base with their reps? I know they're working. We're all working. I know it seems like that you think that something can happen, and on a broad scale, we're trying the best. I had a conversation with the regional manager for Conger yesterday, and they are working on providing better hours. They're trying to comply with our hours for seniors to go in and shop, and so we are constantly telling them and giving them guidance to go to the CDC, go to the health department to get guidance on how best to protect their customers, because we know that people are still going to need to grocery shop, and people still are going to need to go get their essentials. A lot of factories and manufacturing places will be shut down eventually. Maybe is the answer that I have. I know that there are some factories that, so you have to think about this in a more global scale. We need essentials. We need food. We need canned food, prepared food, all the things, sanitizer, soap. those things don't make themselves, and so people have to work to do that. And so I think that you'll see large manufacturing facilities and companies trying to find ways to protect their employees while still also providing those necessities. So I know that Toyota Boating is shut down for a while. Pacific Manufacturing, I think, is going to shut down for a while to do some cleaning. But at the end of the day, we as consumers still depend on some of those necessities. So I think you also see a shift in some of those manufacturing facilities that provide those essential needs, finding ways to protect their employees so that they can still go to work. Let's see. I have a mic, but I'll just pull my mic out and I'll talk loud because I don't know what the problem is. I know it's on. I'm not gonna do that. So, all right, let's try this now. Good questions coming in. What do you help as agencies at this point? So the conversation of individual assistance for those losing their job. Yes, there's conversation. There's a fund set up with the West Tennessee Healthcare Foundation. Mike mentioned a few minutes ago that we are committing $10,000. There's already $20,000 in that fund. $10,000 that I'm committing is a matching $10,000 to encourage others to give. So starting at 4 p.m. today, every dollar donated will be matched dollar for dollar for up to $10,000. So that's a goal to put an additional $20,000 in that fund. We're working on ways for those that are displaced, lost their jobs, to get access to that, whether it's an application process, they fill it out, a reference check with their employer to make sure that we're doing it correctly and that we're doing it efficiently. And we will get that information out as we get it done. Yeah, Chaz, you're right, and that's the conversation. But still, no matter what hospital is empty, it has been closed down. It takes a lot of manpower and a lot of dollars and a lot of equipment and PPEs to get that going. More aggressive plans. Or I would say that, we don't have plans, and this is as much as we're going to do. This is a very fluid situation, and so, we are trying to respond and be proactive and stay out in front of this and be as preventative and do everything that we can to flatten the curve. Quite honestly and candidly, if you'd have asked me last week if I was going to issue a state of emergency and close bars and limit capacity of restaurants, I would have said you were crazy. And so this is a very fluid situation, and we are doing our best every single minute of every single day to make sure that you are protected and make sure that we're doing everything we can. So as of right now, there are no plans for a lockdown. We are, keeps jumping around. We are trying to do things. So it really depends on all of us. We have to do our part to make sure that we're social distancing, to make sure that we're limiting contact, that we're doing things that we can to prevent the spread of the virus. I did say Pacific. I think they're shutting down for cleaning. I may be wrong. It has been a long week, so I may have some information wrong. Gyms, salons, nail salons being asked to close. They're not being asked to close, but I am strongly encouraging and strongly trying to provide guidance to them to practice social distancing. Being in close contact is how this virus spreads. And so we have to make sure that we're practicing social distancing so that we're preventing that from happening. The last thing that I want to do, the last thing I wanted to do is provide those executive orders. And so gyms are, I know some of the gyms are practicing, they're wiping them down, but they have to stay at 50% capacity of what their gym can hold so that they're not too close to each other. Nail salons again. So if price gouging is in the city of Jackson, then you call my office. We'll get that taken care of. If it's outside the city of Jackson, then you need to report that to the governmental body that has jurisdiction of that. If there are updates from Governor Lee today, we haven't been sending anything to us. I assume that he did a press conference at 3 o'clock. That's why we did ours at 4. But I've been unable to watch any press conferences. I've been on the phone all day long, so I don't know. I I've already answered the question about gyms. If I speak any louder, I'm going to be yelling, so turn your volume up. I don't want to yell, and it looks like I'm angry, and it looks like I'm mad, so just turn your volume all the way up. All right. If you can't hear, I'm sorry. Doing the best I can. Having you constantly say you can't hear is not helping me out when I'm trying to communicate. So, thank you. Let's see. Going down. So our security, now when you say security, I mean, I'm assuming you're asking about our police force. Our police force is making plans to make sure that we're patrolling and keeping you safe. Chief Weiser is in meetings with me every morning. We have a constant conversation about what we can do to make sure we're ensuring safety. Let's see, what restaurants are closing and who is getting stimulus package? It's a great question. The chamber will have all that information on their website. They're updating and aggregating that information and data, and so they'll be providing that. So you can see what restaurants are closed, what are open, if they're having to go, if they're having delivery. You can check on that. Stimulus package, far above my pay grade. That's a federal level, and so that has to go through Congress for a stimulus package of when and who gets that. Okay, we've established the volume's good, so that's, you got a question, let's type that in. No, I have not spoken with the National Guard because that's an absolute last resort. I know that the National Guard has been in contact with our emergency management and our EOC here in town, but as long as we're doing what we can, the National Guard is an absolute last resort. We don't want to militarize our city. We want to make sure that we're providing the resources, providing the opportunities for our citizens to be safe. I don't know that an MRE can be purchased right now, to be honest with you. I've heard some people talk about trying to purchase them online, and they're all sold out, the sites they've looked at. So I would encourage you to go buy canned food if you want to stockpile. I think it's another thing that we see. We're looking at our food banks, providing those who are going to need it most in the coming weeks. Buy canned food. If this rush to stockpile meat and freeze it and vegetables, I understand, but that's where our most vulnerable. That's where they get fed through our Mid-South food bank. And so, buy canned food if you want to stockpile things. Make sure that you're not hoarding. I know that's a huge temptation to do that. But the more you hoard, the less is available for everyone else, the less is available for those who need it most, who can't afford to buy, who are depending on food banks to get their food. And so the more we hoard, the less we are looking out, and the less we're being our brother's keeper if we're hoarding. So make sure that we're doing that, and getting a supply is one thing, but over purchasing and purchasing and buying just for the sake of doing that is not going to help us out in the long run. Yes, school system is providing. Sorry, I'm trying to read as I'm talking. I understand. As a small business owner, I understand it's a tough time. This is a tough time for everyone. We are constantly analyzing and assessing every day, every hour, every minute of what needs to be done next, and we want to make sure that we're making the right decisions. The school system will be providing lunch and breakfast for students next week, and then I think they have 8 drop-off points or pick-up points that parents and students can come pick the food up, and hopefully they will assess that at the end of the week, because then provide delivery options for students in the coming weeks. All right, we'll go a few more minutes if you have any questions, and then, so the next step for Madison County to get the first positive. I think that we're we're doing that. We're working our steps. We are acting as if we have positive cases right now because we know that we can't test everyone. So we're taking those precautions now, and a positive case just confirms what we already have been thinking. So we will keep doing and taking the necessary steps to ensure safety of all of us. Let's see, I don't know what happened here. I mean, I don't see us run out of gas. I don't think we can stockpile enough gas to run out. I think there's plenty of opportunity to get gas every 5 days. Okay. Employees stop seeing employees who are not symptomatic claims to be tested. Yeah. Yeah. So if you're an employer, I understand that you want to make sure your other employees are safe, but Madison County doesn't have the capacity for test kits, so they're not going to test. For someone to come back to work. They can provide a note that says they're not symptomatic, but there's not a test to send someone back to work to see if they have symptoms or not. So we are just positive. So we have 0 positive confirmed in Madison County. We have 10 tests still pending, and so they will be notified as they can test those. Hair salons and nail shops. This is probably the last I'm probably going to address this because I think it's the 3rd or 4th time. So if you get to the point you ask a question I don't answer, that means I've covered it a couple times already, and I'll just ask you to go back into the video and see. That way we're not just on a constant cycle of the same questions. Asking them to practice social distancing, to make wise decisions about operating your business, operating your chairs. It's imperative that we individually take responsibility for how we interact with people so that we're not spreading this disease. I don't know, Sherry, if schools are going to be closed longer. Convenience stores and grocery stores, those are places where people can get things quickly. There's kind of a pass-through thing. People aren't congregating, so I don't foresee those closing. But I mean, if we're being honest again, I didn't foresee me doing an executive order this week to shut down bars and limit capacity to venues. So this is a fluid event that changes every day, every minute, every hour. I'll do about 2 or 3 more questions, and then we'll start to wrap it up if you have any more questions. It's a great question, Allison. I would recommend not going to the nail salon. So like I said, we have to, at some point, at some level, have to make decisions that are going to not only be affecting ourselves but other people, and we have to have responsibility for the decisions that we make. So I encourage you to make responsible decisions to do that, to make sure that you're protecting yourselves and protecting others. And again, I mean, you may not think this is serious, but it's a serious event. It's about capacity in our healthcare system, not just in Madison County, but state of Tennessee and throughout the nation. It's about making sure that we're taking care of our most vulnerable populations who are at risk, and making sure that we're looking out for them. And so it's not just about us getting the cold, it's about everyone else. It's not about you getting sick, it's about you transmitting that to other people. What is the rule on having church services public place? Again, if you are a venue open to the public, that is number 6 in the executive order. If you are a venue open to the public, you have to be at 50% capacity, no more than 100 people. No top of spectrum reps. I'm trying to work on saving lives this week, and internet is not on the list of priorities, to be honest with you. We're trying to make sure we're making the right decisions to keep people safe. Daycares will not close. We're working on trying to get more daycare opportunities available. If you check out with the Department of Human Services and Department of Health, and CDC, they give guidelines on why daycares are essential right now. We have designated times for elderly shoppers at every grocery store and pharmacy. The hospitals are discussing that. Some doctors are suspending elective surgeries right now. As far as I know, there's no deferment of mortgages in the state of Tennessee yet. I do know that they've passed a law that doesn't get you evicted or get you foreclosed on right now, but they're not suspending the mortgages. All right, hold on. Y'all came in with the questions quickly. As test kits become available, we have plans to put up drive-through testing sites, but you would have to have the resources to do that. I don't foresee the city being on lockdown or shutting down, but to be completely honest, I didn't foresee getting an executive order this week to shut bars down and limit capacity in restaurants and public venues. So the situation is ever evolving. The police department here in Jackson, Tennessee is going to handle calls like they always have. We are putting in policies to protect the police officers and protect the ones that they're serving with social distancing questions and interviews when they get on scene. So I'm going to answer this question again. What I see right now, what I've done right now is what the plan is. I don't want to have to close or mandate closing of anything else. It's a heavy decision that I had to make. I'm asking people, I'm asking you all to practice social distancing, to be responsible, to take ownership of what we all have to do in protecting ourselves and protecting each other. If we do that, then I don't have to make these decisions and I don't have to force people to close. There are no testing sites in Madison County right now, outside of some clinics, and they have limited testing, but testing is only for if you check every single box of being high risk, of being elderly, and having all the symptoms. So you can't just go to a clinic and say you want to be tested. Let's see. All right, so it's about 4:30, and so thank y'all for tuning in and asking great questions. I know this is a concerning time for all of us, but you know we're all in this together. This is a great, you know, if you look for a silver lining in it, that we're not in this alone. Even though we have to social distance, we're all in this together. We're all going through this together. We have to make sure that we're being responsible. We're watching out for each other. We're screening the people that we're around. We practice social distancing. We wash our hands more than regularly. Use Lysol. Keep things clean. If we could, so Kevin, the hierarchy of testing is on the CDC website, on the Health Department website, and on the Department of Health website. So, yeah, I think we probably give an update. If we don't do one this weekend, have an update on Monday from me. And so we're going to try to keep the conversation and communication as fluid as possible. Okay, thank you, Kelly. So we're working on that. So hope you all have a good weekend. Be sure to practice social distancing and make sure that we are looking out for each other by not being too close to each other. And so have a good weekend.